I'm Dr. Stephen Zimmet. I'm in private practice in Austin, Texas. My practice consists of phlebology, which is the treatment of venous disease, and procedural dermatology. I'm a longtime member of the American Academy of Dermatology and the American College of Phlebology, and I have received leadership awards from both organizations. I'm currently the founding president of the American Board of Phlebology and work as an editor for Phlebology, the Journal of Venous Disease. I am past president of the American College of Phlebology and was their founding chairman for their foundation. Lastly, I am a medical director for drqa.com, a patient education portal that is seeking to provide credible information for patients and increase the awareness about venous disease. The treatment of varicose veins really starts with a proper evaluation. So this consists of a good and targeted history and physical relevant to vein disease, complemented by a duplex ultrasound or sonogram. When you have varicose veins on the surface of the skin, almost always there will be veins below the skin that are feeding into and contributing or causing the veins that are visible on the surface. So we must do that proper evaluation to understand what that particular person's pattern of vein disease is. Once we know the pattern, we can design a treatment plan developed for that particular case. What are the different treatments? One would be conservative treatment. This consists of things like compression stockings and aerobic activity, avoidance of prolonged standing. That may help improve symptoms. It won't really get rid of the veins, but may help slow down worsening of veins, which would be a common issue. Then we have treatment of the veins on the surface of the skin, and generally there's two techniques that we would use for varicose veins, the dilated bulging veins visible on the surface of the skin. And that would be sclerotherapy, which is injection of a medication designed to try and cause those veins to shrink, collapse, and disintegrate. Or in some cases, particularly with larger veins, ambulatory phlebectomy, which is a method of removal of the veins, but done in office in a very minimally invasive way under local anesthesia with needle punctures rather than incisions, such that one does not need suturing. Then we have treatment of the underlying veins that might be feeding into and causing the surface veins. And generally, the treatment is either going to be endovenous thermal ablation, which could be laser or radiofrequency, again designed to get that underlying vein to close off, shrink, and disintegrate. This would be an alternative to vein stripping, which would be surgical and require general anesthesia. The other alternative would be called endovenous chemical ablation, which is where we would, with ultrasound guidance, image the underlying vein and then use foam sclerosants and make injections with the same goal, to close that vein, get it to shrink and disintegrate.